well, hello everyone, and good afternoon and happy new year. Happy 2022 from the Ohio Program for Campus Safety and Mental Health. My name is Jessica Zavala, and it's my pleasure to welcome you on behalf of our center to today's webinar, Promoting Student Wellness, Success, and Retention, Applying the 8 Dimensions of Wellness. Before I introduce our panelists for today, I do have a few brief announcements to share. First, I want to let everyone know that CME, CEU credits are available if that's something you're interested in obtaining. The activity code for today's session is 12 REES. That is 12 REES. This code will expire on tomorrow, January 14th at 1 p.m. So please be on the lookout for information that will be periodically posted via the chat function regarding how to obtain CME and CE credits if that's something that you are interested in obtaining. Next, I just want to say thank you for your continued participation in these monthly webinars. And it really is our role as a resource dissemination center to ensure we are providing accurate and relevant information related to mental wellness and suicide prevention resources in higher education. We also ask that you stay tuned for future webinar topics that will cover managing anxiety and depression, strategies for recognizing and overcoming burnout, and hearing firsthand from our students later this spring in a panel presentation. So again, please be on lookout for details via our listserv. And we also invite you to visit our website and or follow us on social media for upcoming trainings this spring. Regarding today's panel, we will have a brief presentation from each of the panelists, and then we will begin an interactive discussion. We do encourage you to post questions and or comments that you may have in the Q&A or chat function during that panel presentation. Finally, this webinar will be recorded and the video will be made available for viewing on our YouTube channel. And now to introduce our panelists, Dr. Danielle Busby is assistant professor at Baylor College of Medicine, Texas Children's Hospital. In this role, she primarily serves youth and families through the Trauma and Grief Clinic and is in the early stages of developing a clinic specific to youth depression and suicide prevention. She has led and contributed to scholarly articles and research presentations on child trauma, youth suicide prevention, racial discrimination among Black youth, and the psychological effects of neighborhood stressors such as community violence exposure among African American adolescents. Clinically, Dr. Busby's expertise is in trauma-informed assessment and intervention, evidence-based clinical practices, and suicide risk assessment and intervention. She is passionate about decreasing barriers to mental health service use for underserved patient populations and is committed to continuously bridging the gap between research and clinical practice. So we're really excited to have her. And next is Dr. Meredith Hope. She's assistant professor of psychology at the College of Wooster. She was previously a scholarship to practice fellow at the National Center for Institutional Diversity. Prior to this appointment, she held the Paul B. Cornely postdoctoral fellowship at the Center for Research on Ethnicity, Culture, and Health at the University of Michigan School of Public Health. She holds a PhD in educational psychology, as well as a master's degree in developmental psychology from the University of Nebraska-Lincoln. Dr. Hope examines culturally specific community contexts as social change agents and protective resources for positive development and health outcomes among at-risk and or Black youth and emerging adults. Recent scholarship has been published in American Journal of Community Psychology, Journal of Ethnicity and Substance Abuse, Psychology of Religion and Spirituality, and Journal of Child and Family Studies. So without further ado, I will turn it over to Dr. Busby first for a brief presentation.
Hello, everyone. Thank you so much for that amazing introduction and for having me today. So let me just pull up my slides. All right. So again, so happy to be here to speak on this really important topic. One small change for my introduction is that I actually recently took a position at the University of Texas Medical Branch. So I was at Baylor, I've recently transitioned, but I'm doing a lot of the same work that I was doing previously just at this new institution. So again, so happy to be here today. So just to walk you through what I'll be speaking on briefly, sometimes you'll see me going through some of the slides really quickly, but that's largely because I want to make sure that I make time for Dr. Hope to speak, but I want to be able to provide you all with this slide deck as a resource at a later date. So this is a little bit about what we'll be talking about today in my presentation. And this is just a visual of what was already done as it relates to my background and training. I always think it's important to kind of give some context to where I'm coming from as it relates to my program of research, as well as just the multiple institutions in which I've been at. So originally from Detroit, Michigan, did my undergraduate training at the University of Michigan. I then went to the George Washington University for my graduate training and Duke University Medical Center for my residency training. And that's kind of what has really informed my areas of expertise. In addition to telling you a little bit about myself, I think I want to also make sure I leave you all with this resource, which is a company that I started with three other clinical psychologists. Our company's name is Black Mental Wellness. I want this to also be a resource for you all. We have a website titled blackmentalwellness.com, where our mission is really threefold. First, we want to be able to provide information and resources about mental health and behavioral health topics from a Black perspective. Second, it's really important for us to highlight and increase the diversity of mental health professionals. And we do that through a national training program where we work with undergraduate students and we team them up with mentors if they're interested in going into the mental health field. So if you are interested in learning more about that for any of your students, please do reach out and let me know. And then finally, we really want to decrease the mental health stigma around mental health and mental health treatment in the Black community specifically. So I do this alongside Dr. Nicole Kamak, Dr. Dana Cunningham, and Dr. Jessica Henry. And we all came together because of this shared passion for really wanting to, just enhance the world of wellness as it relates to Black individuals. So what is the purpose of today? What is the significance? So today, our talk is really focused around the 8 dimensions of wellness, and particularly how that relates to BIPOC students in higher education. And so because of that, I think it would be important to kind of start off by just kind of framing what are the range of things in which we think are really important for students, right? And so that's where the 8 dimensions of wellness really come in. And I wanted us to just be able to have a moment to just look at them, and we'll be able to go into these in more detail as we continue today. But first, I want to ask the question for you all, and feel free to drop your answers in the chat. But what are some common experience BIPOC college students may have? Like when you kind of think about your student population and you know what sometimes students may be struggling with, what are some things that come to mind? And so feel free to just drop those things in the chat. Again, I don't want to spend too much time here, but I did want to frame our discussion for today. And so while you all are maybe thinking about some of your responses, I kind of just wanted to throw out some of the things that we commonly hear about or see, right? So disconnected from peers, faculty, staff on campus, particularly as we talk about now being the COVID-19 pandemic, returning to school in person, isolation, emotional exhaustion. Sometimes we see stressors related to being a first generational college student. It's something that is common. Lack of BIPOC instructors and staff. I see some of these in the chat. Sense of belonging, especially at a PWI. Being remote, lack of support, right? And so I'm seeing, I don't know if I've missed some of the ones, sense of belonging again, feeling isolated and not seen, financial struggles, absolutely. So you guys are hitting it right on the head in regard to some of the things that really may be occurring for our BIPOC students, implicit and explicit bias, sense of belonging, et cetera, right? And so because we know that our students are experiencing a range of these stressors, we know that even though We may be aware of some of them, they're still impacting our students, right? And so these are some of the ways in which some of these things that we've just named as stressors really show up in our youth's mental health. So we know that we may see anger, anxiety, fear, as we talk about COVID-19 and the pandemic, fear of getting COVID-19. I see another comment in the chat, not feeling safe in surrounding rural communities. Very common if maybe a university is kind of in a rural space, kind of feeling like maybe I can only feel safe on campus and it's too unsafe for me to travel too far, right? Because of what that may mean. Isolation, resentment, sadness. Sometimes when we're stressed, we see increased alcohol use, disrupted sleep, irritability, digestive issues, feeling overwhelmed, academic decline due to challenges with virtual learning, or maybe some of these feelings of being isolated and not really being able to connect, right? And decreased focus and concentration. So I know we know these things are happening, but I think sometimes it's important for us to just kind of name them and think about all the ways in which we know that these stressors may be impacting our students. And so what I'm going to present is one of the studies that I worked on while I was a postdoctoral fellow at the University of Michigan, where we really looked at Black college students who were at elevated risk for suicide. And so what that meant is that they had a positive screen for depression, they had a positive screen for suicidal ideation, alcohol use, and any type of past attempt history, right? So if they endured any two of those four indicators, we indicated them as being at high risk for suicide. And so I'm going to go into the details of that study in a bit in regards to what we find as it relates to why those students maybe weren't seeking services or weren't seeking support for some of these stressors that we're naming. And so what's really getting in the way? A lot of times what we see is that in the research, we've seen that perceptions of problems are minor. So sometimes, like, even though I'm experiencing those stressors that you all just saw on the previous slide, maybe they're not a big deal, or maybe I know people in my family that are going through worse, so they're, it's fine. We also know that Black college students seek mental health services at significantly lower rates than other racial groups, and so knowing that, we kind of have to be intentional about how do we reach this population, how do we kind of help support this population, or maybe even find other means of support for this group that may not be formal mental health services, but still addressing some of these stressors that we just explained. And then we also know that Black college students experience increased mental health stigma, as well as just a general mistrust for the medical system, given a range of historical things that have happened within the Black community that have led to greater mistrust. This is just some information, again, I'm not going to go through this in detail, related to disparities in care as it relates to culturally diverse individuals and community. And I might really be speaking to the choir, but I think it's always important to name it. But we know that they have less access to and availability of mental health services and are less likely to receive needed mental health and substance use services. And when they do, oftentimes it's poor quality of care. Right. So I think it's important to really address that and name that as something that we know is going on. And that's, something that is happening prior to youth or even getting to our campus. Right. So we're seeing these disparities in care. And so again, what is getting in the way of BIPOC students at elevated risk for suicide specifically? So these are students who, even though they're at elevated risk and they had the option to receive services, they still decided not to. And so my research question here was really wanting to understand what was getting in the way and why. And what we found was that largely among Black college students who had these elevated risks, that the primary reason that they were not seeking services is that they had it was related to their perceived problem severity. So they actually, again, similar to some of the past research, perceived their problems as less severe and as not needing any additional support or attention, especially as it related to a formal mental health provider. And so honestly, when I first ran some of these data analyses, I was surprised. I really thought maybe like cultural sensitivity and understanding would have been one of the highest reported barriers for care. But when kind of looking into the data a little bit closer, this perceived problem severity is really important because how do our students develop an understanding of when is it appropriate to seek care? When is it not? And what are we doing on our campuses to help them have a better understanding of when that shift may need to happen, or just generally what overall wellness is? But followed by perceived problem severity, other barriers for care, it's in order. So it was time, fear/stigma, which we know, again, is something that's common, financial concerns, questioning basically like, will this even help or not? Like, is this going to be a good use of my time? Logistics is a lot of times related to like, what time can I get an appointment? and just kind of availability. And then cultural sensitivity and understanding is like, will my provider really understand me? Will they get where I'm coming from a cultural perspective? And so this graph kind of breaks that down by male, female, sex, and then all of the students. And I really wanted to just kind of jump into some of the suggested strategies from that data that we have. And so one is, how can we increase in initiatives on college campus specific to mental health problem identification that is tailored to the Black community? So like, how can we kind of incorporate learning and knowledge around these are the moments in which maybe a mental health provider might be helpful versus these are the ones in which maybe I can do these more independent activities? And how can we include that within, just campus knowledge, as well as like focus on the Black community specifically. So maybe thinking about ways to integrate it within environments and spaces in which we know they are existing in. Also increasing opportunities for learning specific to wellness among Black college students. So again, helping them understand, again, about these 8 dimensions of wellness and the multiple ways in which wellness can show up. And then also in some of my other work, I've also really looked at the intersection of identity. So the importance of examining barriers to mental health services across other subgroups, right? So maybe not just thinking about racial identity, but what about the intersection of racial identity and gender identity, or racial identity and sexual orientation, for example, and trying to understand to a greater degree what these subsets or intersectionalities are experiencing and may benefit from. And then in thinking about additional strategies, I think it's important from an institutional level for us to think about this on multiple levels. So individual level, so this is the own student's personal commitment to wellness and self-care. And that includes, that physical aspect of wellness, so sleep, fitness, nutrition, work-life balance, spiritual health, which I know Dr. Hope will go into in greater detail in just a moment. And then also that peer level of support, right? So peer-to-peer support and acknowledgement. So are there opportunities for peers within certain communities to express gratitude or share responsibilities or in supporting one another? How do we kind of provide space for accountability and guidance? And is there an opportunity for more formal peer support systems? In some spaces, I've seen something called a peer parallel program develop in response to COVID-19 for campus communities, basically meaning that there's a group of designated peers that are going to work to, basically just have a brief call or check in with someone that may be struggling as it relates to some of these stressors like the isolation and feeling really excluded on campus, particularly during COVID-19. And then finally, from a structural institutional level, what formal institutional programs in support of wellness are available? What opportunities for training or exposure are students given, and faculty kind of like in this space today, as well as what college campus policies and responsibilities and work allocations that support not only the implementation of we care about your wellness and here are some opportunities to enhance your wellness, but how do you maintain that across levels and across time? Right? And how do we empower students to kind of know what their resources are in that space? And so I thought just kind of thinking about these from these levels as it relates to strategies would be a good place to start today. And then again, I'm not going to go through each of these slides, but as it relates to mental health treatment and kind of seeking mental health treatment from college students on the college campus, these just kind of break down some of the main things in which I think that can provide for students. So emotional wellness, occupational wellness, as well as social wellness are very prominent things that come up in therapy, but also are just going to come up day to day with students. And so wanting to kind of give examples of what that can look like. But again, I want to be conscious of my time, and I want to be able to make sure that I'm able to transition and leaving enough time for us to have questions and answers later. So I will leave these slides with you as it relates to different examples of emotional wellness, occupational wellness, and social wellness for students. And I'm going to go ahead and transition. So that Dr. Hope can lead us through a bit more as it specifically relates to our spiritual wellness.
Thank you so much. I'm thrilled to be a part of this event as we promote the 8 dimensions of student wellness, success, and retention. Because it is critical that students thrive, today I'll be presenting on a little discussed topic in health and higher education: the role of religion and spirituality with a specific focus on Black students. Today's Black student in college is an emerging adult aged between 18 to 25. Emerging adulthood is a time of transition and preparation for adulthood, where they're navigating relationships, re-examining childhood and adolescent beliefs, and preparing for adulthood roles such as in career and other interests. To start off today, I'd like to share with you that 97% of Black adults believe in God or a higher power. This is a statistic that we can't ignore, especially when it comes to the 8 dimensions of wellness for students and success and retention. This means that most of these students in college are going to be having some aspect of religiosity or spirituality that connects with them on some level. Not only do 97% of adults believe in God or a higher power, but Black youth rank faith higher in importance than other counterparts in other racial and ethnic groups. For Black Americans especially, religion and spirituality provide more than just spiritual sustenance. It provides supports and resources. Historically, religious communities have connected congregants and non-congregants alike to social, political, civic, religious, and educational resources that seek the betterment of the community around them. One quote by Dr. Franklin in 1997 captures this very well. The church in the Black community is more than a religious institution. It's also a social movement. It's a community organization. It is a formulator of practical solutions to everyday living and psychological problems. To Black people in America, the church is a pervasive influence even for those who are not active members or participants. Although I use the word church today, I want to acknowledge that there are other religious communities within the Black community that do not identify as church. And so, but today we want to make sure that we are inclusive today. And so I just want to acknowledge that as well as I continue in my talk. So what are the objectives today? So the first objective is to tell you what is religious involvement, what does it look like? Why does religious involvement matter for Black Americans? And finally, how can these findings be applied? As you're in the chat, I'd encourage you to start thinking about what are some ways in which you think about how religion might be connected to Black thriving, especially for college students and other students as well. Religious involvement includes involvement with a formal organization and associated beliefs, traditions, and rituals. Today, I'll be focusing on 2 different types of involvement: organizational, the community level engagement. This has to do with things like service attendance, congregational activities outside of service attendance, and other things that people would do with a community. In contrast, non-organizational religious involvement involves individual or personal engagement. These are activities that you can do by yourself, such as prayer, reading sacred texts, listening to social media, or other types of media that would have to do with religious topics. So why does religious involvement matter? Research shows that religion and spirituality are intricately and significantly connected to a wide range of health outcomes. Religion and spirituality are much more than belief systems. They are engagement with religious communities that can provide access to emotional and tangible forms of support, opportunities to develop and showcase talents and skills, and access to a community that shares similar values, beliefs, and traditions. For Black Americans, religious communities can connect individuals to relationships. So for many people, congregations provide access to an alternative family of sorts. These are social ties that are voluntary. No one is forcing them to be a part of these contexts. And within these contexts, they can receive assistance. If they have a theology or belief system that supports helping each other, bearing each other's burdens, sharing life events, and frequently shared experiences that are not only tied to religious belief, but also cultural beliefs as well. Religious involvement can connect individuals to social support. In one study done by me and my colleagues in 2019 in the Journal of Child and Family Studies, we found that African-American adolescents who engaged in more congregational activities outside of service attendance not only tended to receive all forms of church support, but they also were involved in providing it. So being able to not only receive support is important, but also you have a significant role in the fact that you're involved in a community where you're able to see needs and you're also able to be involved in that community as well. Notice most studies only assess service attendance. However, congregational activities indicate greater social integration within the community, showing that the social ties that you're able to make there not only make you privy to get your needs met, but to be able to be a part of meeting needs for other people as well. Religious involvement can facilitate ties to cultural heritage. The Black diaspora is ethnically diverse and religiously diverse. And one of the things that we want to keep in mind is that even though religion is very important to many Black Americans, it's important in different ways. For Black Americans with immigrant backgrounds, they can participate in religious traditions and communities that foster space to specific cultural and immigrant experiences. So being able to be a part of a community that shares not only your religious tradition, but your cultural tradition, perhaps even your language, that can be very powerful for Black Americans who have those backgrounds. So for example, Caribbean Americans, African immigrants to the United States, these can be spaces where they receive more than just religious support. Theological beliefs in communities can shape racial and ethnic identity attitudes. So during emerging adulthood, one of the significant characteristics is that individuals are processing what it means for them to be Black alongside what other gender, sexual, or other identities they may hold. And so the theology that people receive within their traditions can affirm or can validate other identities that they're thinking about, as well as not affirm and not validate those identities. And so being able to understand the fact that religious communities are hosting much more than just religious space. They're hosting spaces for people to engage with their culture in a way that they may not be able to do so within other contexts. Finally, one of the things I want to touch on is that religion and spirituality matters so much for health behaviors and outcomes. So for African-American college students, having lower levels of spirituality is linked with a greater likelihood of smoking, whereas religious involvement has been shown to reduce anxiety and depressive symptoms for Black emerging adults. Higher levels of spirituality for African-American undergraduates has been associated with better nutrition and health promoting behaviors. And so you can see there's a wide range of ways in which health and religion are connected. One of the things that's really important in this area of research is that while we know that religion and health are intricately connected for adults, not much work looks at these questions for emerging adulthood. And so that's part of the reason why it's so important for us to be able to connect the dots between what's happening on our college campuses in terms of religiosity and spirituality, because maybe we can find those connections earlier in the life course. Religion and spirituality enhance adjustment at college. So for those who report of religious affiliation and frequent religious practice, they tend to exhibit higher levels of adjustment to college. Academic performance also tends to be higher. Religious socialization can shape psychosocial functioning. So religious socialization has to do with the childhood messages that you receive around religion and spirituality. And is during emerging adulthood and during college, many students are unpacking what it means for them to be a part of these communities, what it means for them to uphold these traditions. Here's a quote from a recent paper that just came out in the journal Emerging Adulthood from a woman who was identified as Nigerian American, who said that she was really suffering from depression and getting help for it was hard because it was something she struggled with it. And then she had the religious component where there was a mental health stigma. And so being able to recognize that for many students, mental health stigma is often, and mental health is intricately connected to their belief systems, and whether or not they're going to seek help is an important thing for us to keep in mind when we're planning, programming, and designing initiatives to reach Black students. Another important factor is that many Black students face racial microaggressions and discrimination on their college campuses due to their racial and ethnic identities, and religiosity can protect against these effects. So in a few papers, religious coping and religious support has been shown to buffer against the likelihood of being diagnosed with a psychiatric disorder when it comes to exposure to racial discrimination, as well as the physical consequences of alcohol. So it's really important, especially when we're designing programming around racial discrimination and trying to figure out how we can alleviate these effects, to keep in mind that faith may be a way to alleviate these negative stressors. Finally, I'd like to, there's a couple other ones, but in the sake of time, I want to just close with how can we apply these findings. First, we can revise our intake and information forms to include questions about religion and spirituality. We can create programming that integrates faith journeys with mental wellness and behavioral wellness. So opening the door for students to talk about their faith journeys as well can be a great way to start. We can establish safe spaces for religious identification. Often within higher education, we don't have a lot of safe space for students and faculty and others, administrators and other staff to identify themselves religiously, and by making safe space for religious identification may offer up opportunities to connect students and other adherents to ways in which they can connect to safe spaces and to connect to resources that they might not have been able to before. Finally, they can develop and maintain cultural competencies that center Black religiosity and spirituality. And remembering that ethnic and religious diversity play significant roles in how religion, spirituality, and health intersect. And this is not just important outside of higher ed, but it's important to keep this in mind in higher ed spaces as well. That concludes my talk today, and I'm looking forward to answering your questions.
So again, I want to say thank you to Dr. Busby and Dr. Hope for those brief but insightful presentations. And as a reminder to those who are participating today, the PowerPoint slides will be sent out to the listserv. So that information is something that we will share. And so we will transition to the discussion part of our webinar. But before we begin the discussion, I just want to remind everyone to please feel free to post your questions and comments that you may have for our experts today in the Q&A as well as chat functions. And then also, if you are comfortable sharing, we really would like to know where you are joining us from. So also please feel to share with us your name and institution and or community organization that you may be representing or joining us from today. So I guess I will go ahead and kick it off with some questions that we do already have prepared. But again, we are very interested in answering questions that that you all may be experiencing, again, at your institutions of higher education, that will be helpful for you in working with BIPOC students and addressing the 8 dimensions of wellness. And so the first question really under emotional or mental wellness, coping effectively with life and creating satisfying relationships. And so I think you both talked about, opportunities to better engage BIPOC students for services. And specifically, we know their mental health needs, has been impacted severely by the ongoing COVID-19 pandemic. And they may have experienced loss of loved ones, certainly at a greater rate than, the other population. And so you both have extensive expertise and experience working within higher education. Could each of you maybe share some strategies or best practices? I know you both began to talk about them in your presentation, but taking that deeper dive for those who are participating on the webinar today. And again, we have, I know, individuals as they're beginning to post in the chat, representing counseling centers, student affairs, and various other university centers that work with BIPOC students. Maybe some things that you all have found to be successful with engagement. And Dr. Busby, we'll kick it off to you first, if you wouldn't mind sharing.
Yeah, absolutely. Well, I think there's so many different ways to go about this. And I think for all of us, we're seeing that COVID makes it that much harder, right? And so I think even just in thinking about the findings from the study that I presented related to BIPOC students who were at elevated risk. So these are clearly students that would benefit from services to some degree. But I think it's important to kind of start from that standpoint of just really understanding that everyone, even if they are presenting with stressors or outcomes that are, not, demonstrating the most positive outcomes for mental health, that they may not even know that they're in a position for needing support. So I think some strategies are just kind of like general education, or really having an understanding of how do people make decisions, and kind of going to the students, like how do we make decisions about what to do next, or what and when to reach out for additional support. But I also think it's really important to provide students with resources that they feel that they can connect to. And so, just in even thinking about the creation of Black Mental Wellness, one of the reasons that we created this online platform and this IG platform on Instagram was really because we felt like there wasn't really a lot of spaces that were particular to Black students or Black people that really spoke to mental health from a perspective that felt relatable. And so providing students with those resources and like connecting with them from a place that they already kind of understand, I think is an important first step, right? So I think sometimes, especially for myself as a psychologist, if you walk up to someone like, oh, you need to do this, 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 and this, it's kind of overwhelming, right? It's like, whoa, I hadn't even decided if I needed to seek treatment yet, or not, right? So kind of having those discussions or creating platforms for discussions for youth or students to be able to state, like where they're at and their understanding of their needs, and then providing a range of ways in which they can kind of get those needs met. So sometimes it does look like going to therapy, but sometimes it's like, let's be more intentional with the support group you already have, and how are you all connecting weekly, right? So maybe you all can do a Zoom call, or maybe there are other ways to kind of get some of those needs met around social support if that's the primary concern, versus, hurry up and get to therapy, right? Because sometimes people are going to be resistant to that at first, and kind of helping people warm up to ideas around support in that way.
Thank you so much for sharing that. So certainly I'm hearing engaging the students and really hearing from them, what are their ideals, and, incorporating, again, their thoughts about, what does this really look like for you and getting help. Dr. Hope, I'll kick it over to you with anything additional you want to add.
Sure, thank you. Given my background in religion and Black health, being aware that for many Black students, religion and spirituality play significant roles in their life is important. They may not be actively engaged. They may be sorting out what it means to them to be religious or spiritual, or perhaps not at all. But having the tools to ask the questions can be a great way to support them in this. There are many, evidence-based resources and interventions that are aimed at helping students cope with life struggles. However, because faith is not a significant part or supplement for these interventions, we may be missing out on a wonderful resource for these students. And so that's one of the things that I believe would enhance our engagement, is to find ways to connect what we already have as evidence-based work, to connect this, to bring in this work that we know about, that religion and faith are significant components for Black wellness.
I wanted to just kind of follow up to that, Dr. Hope, and read a comment that I see in the chat that I think is really relevant. And it says, and thank you for this person for leaving this comment, but it says, I've run into students turning from mental health help due to their family/church telling them to just pray about it. How do you get them to understand they may need more help than prayer in some cases? And so I love that question, because I feel like I often come across that as a response, particularly in the Black community, to a range of stressors, not just among college students, but among all individuals. And just understanding that that's a very common source of support and, response to anything related to therapy. But I think really it's important to really emphasize, well, right, the church is to not necessarily say, no, the church isn't good enough, or no, prayer isn't good enough, but that those things can coexist with other resources. And I've seen different mental health providers, some people who are mental health providers and pastors, kind of really do a good job of laying out the multiple ways in which really some of the things that we do clinically overlap to some of the things that we know the Bible and like biblical scriptures kind of allude to or state. And so even, sometimes helping students kind of see that there's really an overlap, or that there are multiple ways in which we can go about this, that one doesn't have to exclude the other, right? Like if I pray, that doesn't mean I don't need to seek a mental health provider. If I'm a mental health provider, I can't be thinking about spirituality and prayer, but really thinking about the ways in which all of these things intersect for students, and emphasizing those points of intersection, or really supporting like, wow, I love that you're making sure that you're in prayer. How often are you in community with your other, people attending your church? Or what other ways do those people seek out support when they're struggling? Like kind of using the things that they're already giving you, because I believe in a strength-based approach, and following out ways that you can kind of include other resources that they may be unaware of at the time.
Thank you both for those comments. And really, speaking about intersectionality, this next question, I think, Dr. Busby, would be for you. But, and I know you talked about, your research and efforts specifically focusing on Black college students with intersecting identities. Is there anything from, and I know you also talked about, elaborating a little bit more on it during the discussion, but is there anything that you would want to enlighten us on within your research endeavors from that presentation earlier, taking a deeper dive into maybe something that your study, regarding Black college students and intersecting identities that will be helpful for the audience to know?
So I didn't actually present my study that really talked about the intersection of identities, but in another study with college students, where the focal point was to really understand not just what is the impact of aspects of racial experiences like discrimination or other things that are particular to one's racial experiences on particular outcomes, but to think about, and those outcomes are typically related to suicide risk, right? That's really my area of research. But thinking about how other intersecting identities can impact those outcomes as well. And so some things that we know in the literature is that, for example, when someone identifies within the LGBTQ plus community, that we also see these higher rates around suicide risk. And so we want to be conscious of that. We want to know that that's happening for students and make space for that, right? So like sometimes I know when I talk to people who maybe identify as Black and identify as LGBTQ plus, they don't always feel safe in both spaces, right? So like when I'm connecting with people who identify as Black, and that's our primary reason for connecting, sometimes I feel a lot of stigma or discrimination really around my sexual orientation, right? Or when I'm in spaces that are really promoting, aspects of feeling connected around my sexual orientation, I don't know if I really feel like my racial identity is like salient in those spaces. So being aware that sometimes, in wanting to provide space for students to connect and have other sources of support, thinking about that intersection as a real aspect of another group that may be needed or another type of support that may be needed. But I think it's so important to go to the students and like you said, you all will be working with students later this year on a panel, but really hearing from them, like, what are the needs? Where are they lacking? How do we kind of, put this communication out that we have these resources, or that we want to even create these spaces, right, for more specific identity-based support.
Excellent. And I do see that there's a question that presented in the chat, and it states, what are your thoughts on peer-based support initiatives? For instance, we are aiming to provide mental health first aid training to student organizations. Looks like that's from John Ellis.
Mm-hmm.
Well, you want to comment on that?
I'm happy to respond first before Dr. Hope responds, but I think that's a great idea. I think we really want to think about this from a levels perspective when we think about wellness and even strategies. Like there are things that students can be doing individually and we can support them in. There's that peer level, right? Like in a community space, peer to peer. And then there's structurally like what the institution, professors, like things that are happening from that realm that are going to impact wellness. And so from the peer perspective, I think providing other students with mental health first aid is a really good start for being able to identify risk factors, for being able to identify kind of like those next steps for if someone is at elevated risk for suicide or has elevated risk around a particular stressor or mental health problem. And I think in doing so, it allows, students to feel, one, a lot of times when I see peer-to-peer support, it's like I'm sharing my own experience, right? And like, you're not alone because I've had something maybe related, maybe not. But I've struggled too, basically. And now this is some way in which I can support. And I think the idea of giving back or supporting other students is also healing for students that may have struggled themselves. Like when we kind of think about ways and strategies to kind of enhance community and enhance connectedness.
To follow up on that, one of the things that I think is an excellent resource are faith-based organizations on campus, because a lot of students may be who are interested in connecting their faith, being able to provide that peer-based training to people in those organizations. That would be a great way to intersect faith and mental health. I also know that for many people, they may not always feel like that they can open up in different organizations or different contexts about their mental health. So doing it in a place where they might feel more comfortable, that might be a great way to bridge that gap.
Excellent. Thank you both for responding to that question. There's another question that presented, and then we will kind of move on to some other segments regarding the 8-dimensional wellness, but also monitor the chat. This question states, as a middle-aged white guy, I provide mental health counseling and teach 1 credit intro to college classes. I am very open and direct with students regarding issues / impact of institutional racism, discrimination, etc., as well as my own unconscious, unintentional stereotypes, Any suggestions on brief videos to show in class that validates BIPOC students' experiences as well as enlightened non-BIPOC students. I don't know which one you would want to tackle that.
Actually, I love that question. I'm glad that you asked. And I actually didn't include any of those like links and videos in this set of slides, but what I'll do, Jessica, is I will add that and just kind of include an additional slide in my materials and send it to you all. But there are some videos. It's not particular to college students though, but I think we can still glean information from it. It's actually a group of 12-year-olds because I work with adolescents into emerging adulthood. So I kind of have that span as it relates to development, but it's a group of 12-year-olds just kind of talking about their range of experiences, not even just like the real direct experiences of discrimination, because I think those are obvious to many of us and we know that those are a problem. But I think the really detailed experiences that give light to college students' experiences oftentimes are microaggressions and kind of like aspects of more implicit bias that may occur and how that shows up for them in the everyday. So I'm happy to share that resource with you all as a starting point, because I think those conversations need to happen and kind of you could use that as a space to say, like, I know these aren't college students, but if this is happening at 12, I'm pretty sure it's happening at 18 and through their college experience. So I'm happy to share that resource.
Dr. Hope, anything you'd like to add?
I would love to say that there's a lot of empirical work that provides opportunities to read journal articles, such as Kevin Nadal's work on racial microaggressions, Dr. Daryl Wing Su's work on racial microaggressions as well. So I would encourage you to look up those two researchers, and I would personally be happy to send those resources over to Ms. Zavala's office for anyone who's interested in learning more.
Thank you so much for that. And so moving on to spiritual wellness and really discovering a sense of purpose and meaning in life. Dr. Hope, you talked about religious socialization shaping psychosocial functioning. And I'm really looking for you to expand on this. And also to the contrary, excuse me, can you speak on the impact of how being away at campus can impact the student if their religious community is no longer available? So how might that impact the student if, you know, that religious community is away hundreds of miles, or maybe for an international student, how might that impact them?
Great question. So religious socialization concerns the ways in which religious traditions, practices, and beliefs have shaped and formed how individuals, namely youth, view themselves and the world around them. For Black youth, religious involvement and religious socialization specifically may be tied together with access to predominantly Black religious organizations and communities. This means that they're not only exposed to religion, but they're also connected to cultural heritage in ways that they may not be in other contexts, religious or otherwise. For students away from home, there's obviously going to be a significant adjustment to all facets of life because you're moving away from home for most students. For students of color, for Black students, this may be the first time they have to decide in what ways that they want to continue, if at all, any religious observance or involvement. Some students may choose to follow along with their communities online, foregoing in-person religious functions and on campus. For students who attend colleges that are located in predominantly white areas, they may have a more difficult time finding a place of worship that feels like home. Now, this is not to say that all Black emerging adults are growing up in religious traditions that are predominantly Black. Many people are going to multicultural traditions or other denominations that may be a different cultural mix-up. But it's important to know that most people, if they're Black and they're going to a religious community, it's predominantly going to be Black. It's incredibly important that they have connections to find a place of worship that feels like home. It's incredibly important that colleges and universities are aware that of the potential loss of culture and religious support that can occur when a student moves away from home to pursue their education. So what can we do to help students who want those connections to remain connected to an incredible and often life-giving part of their lives? And so that's something that I encourage administrators, practitioners to really be thinking about. How can we connect these students to find ways where they can plug into these places, especially if they don't have access to them back at home?
Thank you. Dr. Busby, were you going to add anything? Okay, just noticed you were unmuted. Okay, and there's also a comment from Shannon Donnelly in the chat that she used the privacy aspect for students that are reluctant to get help because their family does not believe in mental health therapy, or perhaps they may have not come out yet to their family. And I think, Dr. Busby, that is kind of something that you were addressing earlier, a student with an intersecting identity, part of the LGBTQ plus community, who may have not come out yet to their family. So thank you so much, Shannon, for sharing that with our stakeholders who are also participating today. Moving on to environmental, and I do have to be cognizant of the time. And I also do want to remind you all that, again, please feel free to post any questions or comments as we're moving forward in time in our question and chat functionality. Go ahead, Dr. Hope, were you going to add something?
So I just had one more thing that I wanted to add on the question about spirituality, and it had to do with providers. I know that many providers can be hesitant to engage with spirituality. And so I just wanted to quickly say, do you show a similar level of apprehension or hesitancy to engage racial or ethnic heritage? Because for many clients, you'll be seeing religion and spirituality are intricately connected and intertwined with their racial, ethnic, and cultural identities, for better or for worse. And so merely asking individuals if there are any worldviews or spiritual identifications that impact their lives is a great way to open the door to discover if religion and spirituality are impacting medical or mental or behavioral health. And that can also be tied to what we're going into in terms of environment. What environments do you have access to? So I just wanted to add that really quickly.
Thank you so much for including that piece, because I think that does get to the point of, the assessment and, what questions, are on these kind of, when students are coming in for services, if that question isn't there, that could very well be something that can help facilitate the conversation, help them to, feel more comfortable in reaching out for services. So thank you for including that piece. So again, moving on to environmental, and again, we're talking about good health through pleasant environments that support well-being, or even creating a culture of care. And so I'm going to pose this question to both of you, and understanding that there are a myriad of initiatives and programs in higher education. There really are great examples, I think, of how institutions have created a culture of care. But perhaps you all may have some strategies or best practices as we continue in, again, this COVID-19 pandemic, of how campuses can continue to create or even expand this culture of care to help students to feel valued. Perhaps you might even have some virtual examples of what you can share, again, to our participants that are on today. And Dr. Busby, I'll kick it off to you first.
So I think one thing that I've really loved about seeing college students during this time is that they have been really creative, right? Like, they've been really resilient and really intentional about finding ways to still stay connected. And so, different student organizations on campus have kind of put together a range of different virtual events that I've seen, particular to, just aspects of interest that they have, but also around wellness and like how they're navigating COVID-19 to kind of really use each other as springboards for resources. Sometimes that includes like trying to make it more interactive by maybe mailing students who are going to be participating in that activity, like something that they can all use like in person while being on video so that we can remain safe. Some schools, depending on what part of the country you're in regard to rules and laws, are allowing people to come together, but smaller groups across different times and, in distance, so like safe distance type settings for opportunities to connect. And then just thinking like, what are ways that we can make students feel connected around the things that are happening in the world. So like Black History Month is coming up. What celebrations or attention are we going to be giving to things in that nature? But just not only that, I know with us making, like, for example, Juneteenth a national holiday, thinking about ways to like show ways to celebrate that with students or to acknowledge that with students. A lot of times students would tell me, like, I kind of feel, especially within PWIs, like I'm an afterthought, like everything else is kind of happening. And then we think, oh, we need to like kind of tie this, thing related to Black students in, but maybe kind of thinking about that from the beginning and being intentional about kind of like making that space for celebration and community.
And Dr. Hope, will you add anything?
Sure. Just to connect with what Dr. Busby shared, I believe that creating the physical and financial and visible space for students to be affirmed in whatever faith or identity they have is important. So for example, at my institution, resources for spiritual and emotional development are regularly shared by the chaplain's office campus wide. And so those are some ways in which that we can think about what are we doing to make sure information is out there for students, as well as helping them find active ways to use that information is really important.
Thank you both. And there's another comment here in the chat from Frances Robinson representing NAMI. And she shared that, there are some trainings, mental health awareness, QPR, things that they're offering in terms for student activities to promote education to their peers. And so thank you so much, Frances, for sharing that inside of the chat. And then Danielle, looks as though you've also posted some helpful videos for folks to kind of take advantage of. So we do encourage you to, click on those links and download those resources. We will also include that when we do send it out to everyone on our listserv. And so we just have a couple of minutes left remaining, excuse me. And I do want to just kind of address this last question again. I know we are all still experiencing and going through this ongoing COVID-19 pandemic, and physical wellness is very important. And so perhaps there may be some final words of advice, Dr. Busby and Dr. Hope, that you can perhaps recommend for our faculty and staff that are participating today. In other words, how are you taking care of yourself? Self-care is just so important. Dealing with the challenges of changes in remote learning and synchronous learning. Just so many things are changing day by day, CDC guidelines. So just any final words of advice of how you can take care of yourself that you could pass along to our participants today. And Dr. Busby, we'll start with you.
Well, one, I think it's so important to acknowledge that, none of these areas of wellness are like operating in isolation. Like when we talk about our physical wellness, we know from tons of data and research that there's a clear mind-body connection, right? Like how we're thinking and kind of how one's mental health is going to directly impact physical health and vice versa, right? So I think one way in which we can take care of our physical health is also taking care of our mental health, right? In the ways in which we've discussed today. But then also like just being intentional about how we move our bodies, how are we kind of like making sure that we're having nutritious meals. COVID has been a really interesting last few years, and we've kind of all had to get flexible with like still living our lives, but kind of changing our lives and still being safe and kind of still trying to like not let that overwhelming anxiety of fear kind of take over. And so I think for me, what's been really helpful is that I've just really tried to be really strict about routines. And so that's kind of like for me getting up earlier so that I can make sure that I do my workout in the morning, because Lord knows when I wait to the end of the day, it's like the likelihood of it happening decreases drastically, and modeling for our students that we're figuring it out too, right? So I think sometimes as the leaders, oftentimes we feel like we have to have it all together and I have this pristine way of doing things and I never get stressed. And the reality is like, we're all human, we're all trying to figure it out. And I think being able to express to students, like, this is one strategy I use, it's sort of working, I'll let you know how it goes. And being real about the fact that nothing is gonna be perfect. And in regard to other additional like distinct strategies that I have, because I do a lot of working from home and my new role is going to be largely remote, I'm really big on like, how do I make my space feel different from like when I'm working to when I'm not? And so I like have my desk facing one direction when I'm working, and when work hours are done, it turns another direction, or I turn it another direction so that I can have that distinction in space. So I think really being intentional about this is work time, this is not work time, and giving yourself that balance is what kind of creates all those dimensions so that we can give time to the range of ways in which wellness shows up for us.
Thank you so much, Dr. Hope. I'll give the final word to you.
Okay. In terms of how I've been taking care of myself and some of the ways in which I think that we could all maybe try it out. For me, I've been locating the places and spaces where I can safely share about how life is impacting me. I think that it's important to remember that we all matter. And in this time, striving to get everything done may very well be the enemy of thriving, which is a way of us really thinking about, well, how do we want to live during this time right now? And how can we do that in a way that And where can we do that? I think when you think about the where of where when you think about the where of where we're living, it's a lot of tumultuousness, a lot of uncertainty. We want to make sure that we're thriving. We want to make sure that we're focusing our efforts on ways to help each other thrive, not so much to thrive, not so much to strive. And so that's something that I really think is important for me. And so I hopefully that can be important for our students as well, to communicate that to them, that it's not so much about the work you're doing. It's, are you in a safe place to be even able to do that work so that you can live well? So that's all I have to say for that. Thank you so much for having me.
And thank you both for, again, those very insightful presentations, for the excellent discussion, and for those words of wisdom and the final takeaways. And so once again, to our participants today, thank you all so much for joining us for today's presentation. One final time, if you are interested in receiving CMEs or CEUs, the activity code is 12 REES. That's 12 REES, and that activity code will expire tomorrow. So it's going to expire within 24 hours. And so again, thank you, Dr. Busby. Thank you, Dr. Hope, for your time. We will disseminate this information out on our listserv. Have a wonderful afternoon, everyone. Take care.
Thank you.